His sign says family dentistry on it. Well, I know that means he's taking care of all the family, but to me it means he treats you like family. He really cares about his patients. A great dentist, but a better human being.
Patients can tell that they can trust me because I have their best interest at heart. And we'll work with them and do what they really want and what they really need.
He looked at, again, just not what my teeth were, he looked at who I was. And he knew what it meant to me, so he basically made the program based on what I needed as a person as well as what my mouth needed.
He's not gonna let you leave here just looking any kind of way. He's gonna let you leave here knowing he gives it 100%. You're gonna leave here knowing that you're a different person leaving than when you first came in.
To me, a smile is everything. Again, that's one of the first things a person sees about somebody. When they smile at them, they feel approachable, they feel comfortable with that person.
Well, a smile means a lot to me, and it feels real good to have it back again.
Probably the most rewarding thing I do is giving their smile back to the patient. It is rewarding to see that they're like totally changed. Their personality, their person, they come back and they can eat and they can chew and they're smiling and they're beaming. It's just, to me, that's an ultimate reward to see that.
If anybody's looking for a dentist that cares about them, cares about their situation, examines their situation, personalizes it to them, Dr. Brown's the person for you.
A lot of people suffer with dentures. They don't really like them. Very loose. They move around. They don't allow a person to chew very well. Some of them you can make them look pretty good, but generally they're not real tight. What we can do is a procedure called denture stabilization, where you put in 6 implants in the top. Sometimes we can use mini implants, and 4 on the bottom. Strategically place them, and then we use little O-rings on the denture, and then it pushes right into these implants and holds them in. So really good. They're very tight, and boy, people are really happy with it. So a very simple procedure too. Okay, this is a denture, an upper denture, and typically we can take the palate out of there, and we put these little O-rings and these little metal housings, they call it, inside the denture, and then it clips into the patient's mouth for a tight fit. So it's very simple. It allows the patient to taste their food better, to talk better, all around more room for their tongue. This is how the mouth looks like with the implants in, and the denture fits right onto this and snaps right in. So it's very tight in the patient's mouth. Many patients with dentures are told that full reconstruction and implants are the only way to go. And this is sort of an in-between procedure that it stabilizes the denture. Your current denture you can use. So you even use your denture that you have. You don't necessarily have to make a new one. You could, but it can be incorporated right in there where you put the implants in and then snap your old denture right in that. So it's a very simple procedure.
So what was your reaction when you seen your smile for the first time after the procedure?
Wow. Wow. You feel like it gave you something back that was lost or taken away. I feel like it gave you your life back. My name is Sean. I had an upper all on X with Dr. Brown. Back in 2022, I had an accident at work. I got hit in the mouth with some boxes. And I had a bridge already, so the bridge, when I got hit in the face, it cracked. My partial. There was nothing left. There was nothing left to hold the partial. So the next step was, okay, denture, implants. I didn't know what to do. But but my daughter's a patient here. And she said, Dad, why don't you go to my doctor, my dentist? Because my daughter's been coming here for a while. So I've seen her work. She always said, Dad, go to my dentist. But eventually I came in and they walked me through the whole process. So I brought in a picture of myself prior. And they would looked at the picture and they said, okay.
Little by little, talked to him about what he needed, talked him through things. We started with going through kind of a removable appliance, and then we kind of flipped into something more fixed, something that would stay in there.
What got me excited is when he said, Sean, these jokers ain't coming out permanent. He said you could go ahead and eat and do what you need to do. At my church, I lead worship sometime in the morning. And anybody who's in front of people, and you're wearing dentures, you don't want them to accidentally fall out. So I knew those implants were permanent and solid. So it just gives you more confidence. Give you more confidence when you speak. Just give you confidence when you eat. Just give you confidence in life when you smile. It just does. It's changed your life, man. Well, it's not like you add another 10 years. It's gonna add more life to you. You just become more livelier, more happier. You will look in the mirror and say like, wow, people be looking at you something different about you. They can't pinpoint it, but it's something different. I said, yeah, I just had my dental work completed. And that's what it is, man. I can't even tell. I can't even notice. You're a different person leaving than when you first came in.
Technology has come a long way. We used to just mix things and putty and impression materials and all the analog stuff, and now this digital is really making things extremely more efficient, faster, easier for the patient. We can get the result we want faster and easier. Some of our game-changing technology is the CT machine. It's a CAT scan that takes three-dimensional images of teeth. We can see cracked teeth, we can see the bone, we can see different structures in the head and neck and skull. We've got intraoral cameras, we've got CEREC dentistry where we make our own crowns in the office. We pride ourselves in keeping up with the latest things because they're only for the patient's benefit and for our benefit, for efficiency and for help. We're here to serve the patients. Yeah, many patients wonder if they're a candidate for implants. Well, we have to have you in for a consultation. We do a CT scan to evaluate your bone and see if we can place these in the right position, if you have enough bone in different areas, depending on the procedure. The options we have at this office for full arch restoration, if you have no teeth, would be a denture stabilization, where you use your current denture, you make a new denture, and you put in a few implants, and then the denture snaps in. It doesn't have a palate on there, which is nice. The next option is you put a full arch of permanent bridge work, and it can be taken out once a year. It's got little rubber rings that snap it in. The third option is you put a fixed bridge all the way across, all the way around, and it is cemented in permanently. You can't get it out. You just leave it in there. It's the most solid material, top product. We listen to what the patient can afford, what they need, depending on their bone, and work with them together to determine what's the best possible solution for them. Everybody's a little bit different.
Well, a smile means a lot to me, and it feels real good to have it back again. Hi, my name is Omar, and I had implants with Dr. Brown. Well, my dental problems before were I had no molar teeth at all, anywhere, upper, lower, nowhere, and my front teeth were cracking. I went to different dentists, and they all just wanted to pull them out, basically. So every time I went to one dentist, they pulled one out. went to another one, they put another one, so I just never went again. I couldn't eat anything hard because I'll start bleeding and all that. My confidence level wasn't good. I wasn't smiling at all. Like if you look at pictures from before, I didn't smile. My wife worked with Dr. Brown, so she brought me here. Well, I saw a lot of, I call it, work that he'd done before, and I kind of liked him from the beginning. Dr. Brown explained everything to me from the beginning. Well, he would tell you exactly what he was going to do and how he was going to do it. He was very caring and talked me all through it. Well, he gave me different options, and he said the best one would be the implants since I have no teeth in the back. Well, I definitely thought that it was going to be a lot of pain come with it, but it actually wasn't, and I have less to none pain. And when I saw my smile for the first time, I was real happy, and I got to see the real me again. Well, it is a life-changing procedure. It changed most of my everyday things that I do. I laugh all the time. I like my smile now. I could do whatever now, everything. Dr. Brown and their staff, I really appreciate everything they've done for me, and I would definitely tell everybody to come here. Look at my smile and go to Dr. Brown.
Many people that are missing their teeth or are stuck in dentures don't know that there's a solution called All-on-X that can restore their function and their smile. The downsides of dentures are in that they move around a lot. People can't really taste their food that well, and generally people don't eat as well and they're not as healthy because they're not chewing their food. But here in our office we have a solution called All-on-X, which in our office is we place, if you're missing all your teeth, we place 10 to 12 implants sometimes, smaller diameter, and then we cement a bridge to that. The benefits of All-on-X are you smile more, you can eat harder foods, you have more confidence, you know things aren't going to come out or be loose. Actually, you're going to be healthier because you're going to be chewing harder foods. Things taste better, life is a lot better. This solution is the closest to your natural teeth because they're fixed in there, and you're going to have confidence with this that things aren't going to move. Very solid.
When I was growing up, I was prescribed a thing called tetracycline. It would stain your adult teeth. They didn't know as a child when they prescribed to you, your adult teeth come in stained. It would come in gray, discolored. I had some of the worst discoloration they've ever seen. Growing up, it caused me not to want to smile, not really enunciate my words. I'd be more mumbled. It was just it made me seem like I wasn't a happy person or an approachable person, which wasn't the case. And the reason why I didn't get things taken care of when I was younger is I was into boxing. That was something I really enjoyed. I did it professionally for a while. And having veneers or things like that with the boxing, it doesn't work out well. You'd have a lot of cracked teeth. It'd be very expensive. So I waited until 2005. I started doing my research. I saw various things about Dr. Brown, talked to a couple of people about him. Everybody is more amazed about who he was. They talk about who he was more than his work. To me, that's what impressed me. Come here, met him. Just he and his office was very inviting. Just their experience, they make you feel like they're part of the family. His sign says family dentistry on it. Well, I know that means he's taking care of all the family, but to me it means he treats you like family. He really cares about his patients.
Instead of extracting teeth and doing implants, we decided to go with straightening his teeth with Invisalign. They were crowded and crooked, and so we straightened them and then put veneers and crowns on almost all of his teeth all in one day, and it turned out great.
They were able to cover the discoloration. They gave the look I had. They had a real look to them. When I finally saw the procedure get done, I was amazed. I finally had what I wanted, which is the smile. In fact, I think for the first month or so, I think I smiled way too much. Like in pictures, I just over-smiled, just way out there, just kind of over the top because I was so happy about it. So I had to get used to having the smile I wanted, but it was a joyous occasion for me. It was an emotional time for me, but it was a good emotion. I was finally who I wanted to be. I wasn't the person, again, who was closed in, not smiling, not approachable. I was smiley, happy. People wanted to talk to me, and they felt comfortable talking to me. If anybody's looking for a dentist that cares about them, cares about their situation, examines their situation, personalizes it to them, Dr. Brown's the person for you.
Some of the most common reasons why implants fail is infection around the implant. It could be the patient's not taking care of it well, or they don't come in enough to have us check it soon enough. Sometimes they did let it go for years. Also, bites and things like that. If they have a strong bite and they're grinding their teeth. There's a myth that people, once you get implants, you can just leave them and go. You don't have to do anything. Basically, you really do. You have to take care of them. You got to do proper oral hygiene. You have to keep checking them. Yeah, you do have to treat them like regular teeth and keep on top of it and keep regular. There's really no difference than teeth. I mean, if you let things go, they're going to loosen up possibly. And that's why we have to keep checking them every 6 months. It's a maintenance thing that really makes a big difference. Many dental implants are implants with a diameter officially less than 3 millimeters, they call it. Anything 3 millimeters over is a regular size implant. It's just a width size, so they're just smaller, that's all. The benefits of many dental implants are that there is really not a surgery in most cases. It's not cut the gum, lay a flap, and you have to wait. You put them straight into the gum without cutting the gum. You just go straight in, which is a lot less painful, and it's a lot easier, and also the healing time is faster, and the post-operative pain. The next day, usually there's very little pain. Also, the cost is considerably less than real implants. Yeah, the myths you hear about many implants is they're too small, they break, they come loose, there's a lot of failures. It's the same success rate as regular implants. Still in the 90% success rate. And that's what we found doing this for many years. It's an easy system. Something happens, you put one, take one out, this and that, so it works well. Hi, welcome to my office. My name is Dr. Thomas Brown. I'm a dentist here. I've been here for 38 years. This is our front reception area here. And you will be welcomed by my staff here. So here we have our checkout stations right behind the reception area. Just 1 and 2. The patient would come this way, and then they check out at the end of their appointment on these stations. These are for smaller treatment plans and a little less private things. Right here, we've got a private consult room where you can talk your treatment plans and things and go over financials privately. Nobody will hear you, and it works really well. We have great treatment coordinators. We also have another treatment consult room here, which is very private with a door, and where you can discuss the same things, your treatment plans. And this is the CT machine, cone beam, where we take pictures, 3-dimensional pictures of your bone so that we can place your implants in the proper position. It's the latest, latest and greatest. And so that really helps. Okay, and here we go into one of our hygiene treatment rooms where we maintain your implants and your dental work, make sure it stays, and you'll deal with our hygienist. They'll be cleaning your teeth. Here we have the CEREC machine. This is a high-tech milling unit that makes your crowns the same day, so you can come in and get the crown in one day instead of having a temporary and all that stuff. And here we have our surgical suite in this room in the back of the office. We've got all the equipment here to be able to give you that magic smile that you always wanted. Okay, And here we have a treatment room, or one of the treatment rooms where we do the implants and place them and check them and scan them, make sure we're doing the right thing and show the patient everything. This is it. And now we're headed back out toward the front of the office, which is this way through another hallway. This is our second hallway. And, we appreciate your taking this tour with us. We hope to see you soon. Thank you. I'm Dr. Thomas Brown, and I'm here to tell you about some of the most common myths about dental implants. The first myth is dental implants are painful. That's not true. Implants can be placed so that they're not painful, especially the ones we use with our dental mini implants. They go straight into the gum, and usually the patient is a little bit sore that day, and the next day, very little pain. Usually they can take over-the-counter medication for that. Myth number 2, dental implants are only for the elderly. Well, that's not true. We have many young patients who we use one tooth replacement anywhere in the mouth. Sometimes we can use it for bridge replacement, 4 or 5 implants in a row. We see patients from their 20s all the way to their 90s. Dental implants can be a suitable option for anybody's smile or function. Myth number 3, dental implants look fake and unnatural. Well, really, the dental implant doesn't show, it's the teeth above it. And now they've got materials that are so good, they look like natural teeth. They're beautiful. You can't beat the looks. This is going to be the closest you're going to get to your real smile, color, shape of your teeth.